Hypocalcemic tetany, most of those are names that they use for milk fever. Milk fever is just a common name. Okay, to keep things going in the most confusing way. Now we talk about hypocalcemia in equines. Right? Hypocalcemia in equines is referred to as equine hypocalcemic tetany, eclampsia, transit tetany, stress tetany. Okay, so from the name right off the bat, you realize it's a different syndrome in equines than it is in ruminants. Ruminants, flaccid paralysis. All right, paresis, leading to flaccid paralysis. Equines, tetany. Fine muscle tremors. All right, muscle spasms. Okay, that's equine thing. All right. Number two, it is associated more with stress than anything else. It is not associated with parturition like milk fever is. Okay, so there is no within 48 hours of parturition, that type of thing in equines. It is more associated with stress, which is where they get transit tetany from, and stress tetany. More commonly, this happens last couple of weeks of parturition, 1 or 2 days after weaning, after prolonged transport, things like that. These are stressful times for a mare. Right after weaning her foal off, stressful time. All right, just for parturition, just before, stressful time. Prolonged transport, stressful time. Goes without saying, those horses that are participating in endurance races and things like that, that's stressful time for any kind of deficiency. Okay? So it's more associated with stress than it is anything else. The horses that are most commonly affected are draft mares. Right? And some of this is associated with, it may be associated with lack of intake of calcium. It may be associated with excess utilization. Excessive sweating, so that would be your endurance horses. High milk production by big draft horses. A lot of calcium goes into the formation of that milk. But like I said, they usually don't show this thing until they are stressed. Clinical signs are tetany, profuse sweating, anxious, tachycardia, thumps, cardiac dysrhythmias. Okay, so profuse sweating. Okay, muscle spasms, muscle circulation, makes a lot of sense. All right. When we start talking about a horse is anxious, tachycardia, all right, anytime a horse is losing muscle function, they're going to freak out. So expect them to have a high heartbeat. Expect them to be anxious. Any of those diseases that cause them to have some muscular dysfunction are going to lead to them getting very upset, bent out of shape, and anxious. So would you. Okay. Another thing that's on there is thumps. All right. Thumps is a common name for synchronous diaphragmatic flutter. Yeah, just like that. It's doing like that. All right, so your diaphragm is fluttering. You can feel it if you put your hand on the chest wall. You can feel this thumping of the diaphragm. Common in cases where you have electrolyte disturbances. Hypocalcemia, electrolyte disturbance. What does that thing do? Huh?
It's a diffuser.
A diffuser.
Yeah.
There's nothing in it.
Essential oils and water.
Oh, okay, all right. I'm just curious.
It decreases stress.
Sure, that's for you.
Would you like in a better mood or something?
And like,
It's supposed to decrease.
it's a mental trick right now, okay, we're all
It's what?
stressed, it's a mental trick right now.
Oh, okay, you're less stressed with that?
Huh? What?
You're less stressed with the essential oil and all?
Yes.
I'm not making fun, I'm just
got some
asking.
serious thoughts going on. Thoughts are happening. We got
So we're gonna fail a
I
bird
mean,
quiz.
if that'll take care of crazy thoughts now, I get a barrel. Believe me, if it works, I'm not making fun, I'm just curious as to which way it's going. Okay, so we have this muscular condition brought on by electrolyte disturbance because we have a deficiency in calcium. All right, they show what looks like tetanus. All right, this tetanus is the #1 differential for hypocalcemia, tetanus. You are showing some tetanic spasms. Along with that, sardonic grin. Do not ask me to demonstrate the sardonic grin. Other classes have. It's that thing that the Joker does. Everybody's seen Batman, right? All right, that crazy thing like that, that's a sardonic grin. Yeah, Joker. Yeah. Okay. Flared nostrils, ataxia, stiffness in the gait. We already said we're showing any kind of muscle spasms already. All right. Pupillary light reflexes are normal. All right, not like a ruminant, they're normal. GI and urinary function is abnormal. All right, which is similar to a ruminant. So we've got a condition that looks a lot like tetanus. It's associated with stress. They don't show any pupillary reflex dysfunction like ruminants do with hypocalcemia. They're normal in terms of that, but they share the same characteristic of GI and urinary dysfunction. Okay, pretty easy to picture. Horse has a stiff, stilty gait. Okay, they appear ataxic. They have muscle tremors or muscle spasms. Okay. First off, the idea is like, well, how are we going to differentiate this from tetanus? All right. One, we're going to go with history. We want to know if this animal's ever been vaccinated. Is it possible to have tetanus in the face of vaccination? Yes, it is. But it'll be, if you have tetanus in the face of vaccination, it'll be a much milder expression of the disease. All right. Now, tetanus, they talk about prolapse to the third eyelid. Okay, prolapse to the third eyelid is not necessarily pathognomonic for tetanus. It's very, 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 very common with tetanus. You can also have prolapse to the third eyelid with this disease. And there's one or two other things that cause prolapse to the third eyelid. So, prolapse to the third eyelid is high up there in terms of clinical signs, but it is not pathognomonic. Okay. Now, with tetanus,
You can have prolapse third eye with this too, with
Yeah.
hypocalcemia?
all right, they always describe it with tetanus, but it's possible to have it with this also. Okay. Now, how are we going to separate tetanus? All that was wonderful information, but how do you separate tetanus from hypocalcemic tetanus? Tetanus, these animals have hypersensitivity to light and sound. All right, what I mean by that is this. If there's a foal laying here that has tetanus, and I clap my hands, they'll seize up. Okay? They'll have severe muscle spasms. If I shine a light in their eyes, it'll set them off. All right? They have severe muscle spasms. Unfortunately, tetanus is one of those things that really, unfortunately, we see in quite a few foals because people forget to vaccinate babies. They like, oh, I'll wait till, wait till they're a year old or something like that. Well, tetanus is in the soil, so they're always exposed to Clostridium tetani. So if you're gonna vaccinate a horse, and a baby, you wanna make sure, if nothing else, you vaccinate them for that. Because they're going to be exposed to it. Any question?
I was just making confirm that it was tetanus and not hypocalcemia.
Or what?
What you're talking about right now. You just mentioned that it's vaccinating foals, so I'm gonna go with the talking about tetanus.
Right.
Yes, that's what
Okay, all right. Good. You knew what you were talking about, I was lost. Okay, yeah.
So, since you said you could shine a light on tetanus and like the, did they do that? Did they initiate it or?
Yeah. Clapping your hands, knowing the history in terms of vaccination, all of those things are gonna be kind of consistent. You can have different levels of equine stress testing, so the animals are still ambulatory, but they have a very stiff gait and all that kind of stuff. If you got a horse with bad tetanus, there is no ambulation, they're not moving, they're just down, right? And certain things set them off for worse spasms. But that's probably the most common differential. Yeah.
Just to clarify, the hypocalcemia is mostly affecting the moms, not really the baby.
More commonly in mares.
Okay.
Mares, like I said, it's a combination of factors, but more common in mares. But you can have stress tetany in any sex horse or gender horse, depending upon how they're getting that deficiency in calcium. Like I said, if I've got an endurance horse, which probably puts the greatest impact on their electrolyte balance, it can affect any horse. When you talk about horses going through severe stress, well, separating the mom from the baby, that's severe stress. Okay.
Is the PLR normal in tetany? Like basically. So here we have the PLR reflex normal.
Are normal.
In tetanus, is it normal?
Tetanus, I'm pretty sure they're normal. But I'll check and make sure. Alright. So we have some very freaky type differentials. Don't get completely hung on that sawhorse stance thing. Yes, sawhorse stance. Yes, that's supposed to be, something you get with tetanus, but that laminitic horse, his feet are locked to the ground, can look like tetanus also. So, differentials for stress tetany. We already said tetanus, HYPP we get ready to talk about in a minute. All right, blister beetle poisoning. All right. Blister beetles have a substance called cantharidin. Cantharidin toxicity. Blister beetles have it. And if they are in your hay and get into your hay and they're baled up in the hay, and these animals eat this, these equines eat this, they can get a condition that, can be fatal, be enough of it. But they have muscle fasciculations, ataxia, arrhythmias, laryngeal spasms. So that's something that could be mistaken for stress tetany. Exertional rhabdo, those horses are anxious. Remember, they can show a stiff gait. All right? But they have painful musculature. Okay? So if they're showing stiff gait and all that kind of stuff, it's because they have actual hot, painful musculature. Whereas with this stress tetany, you don't have hot, painful musculature. You have a dysfunction in the muscle because you don't have all the electrolytes that you need. Thumps, like I said, you can see thumps by itself or thumps that are associated with stress tetany. What is thumps in pigs? And we got some terms that we use in veterinary medicine that are, different depending upon what species. Remember, we talked about big head in horses, okay, was different. All right, big head in the horses causes bilateral enlargement of the flat bones of the face. Big head in sheep is blue tongue virus. Causes inflammation and enlargement of the soft tissue of the face. Okay, so keep things good and confusing. Thumps is synchronous diaphragmatic fluttering when we're talking about equines. When we're talking about pigs, thumps is verminous pneumonia. Associated with ascaris sum. Alright. I know like 5 parasites. That's all I have left in my brain. Ascaris sum is one of them. I forgot about memorizing strong Giles. They're either roundworm or they're not. Okay? But for you guys, ascaris sum, verminous pneumonia, all right, in pigs, it will come up. All right? How are we going to treat them? We're going to treat them the same as we treat, a cow, all right, that has milk fever. We're going to give it calcium gluconate. Our problem is that horses are more sensitive, so we have to be very, very careful about our rate of flow and how much we run into this horse. More so our rate of flow. If you think it causes cardiac dysrhythmias in a cow, it really causes cardiac dysrhythmias in a horse. Okay? So running calcium into a horse rapidly can rapidly turn to death. So when you give calcium to a horse, you have to give it slower. All right, we have to be very, very careful about that. Treatment, like I said, same as a cow. We give calcium gluconate. We got to be really, really cautious about the rate. Then we'll do the same thing as ruminants. First thing that you see if they're responding, avoid large volumes of urine. If you want to keep this from happening, what do? How do you prevent stress tetany in the equine? Huh? Keep them from being stressed. Yes. So if I got mares that just had babies and stuff like that, I'm not trying to haul them long distances. All right? They're already got a whole lot of calcium that goes into that lactation. So they're kind of low on the calcium side. Now I haul them and exacerbate that. So I'm not trying to haul any mares right after they have babies. What else to do? Supplement. All right? World's easiest supplement for horses, for everything, is alfalfa hay. Alfalfa hay is high in everything, including cost. Okay? But it has everything in it. Hence, all racehorses get alfalfa hay. Hence, all show horses get alfalfa hay for the most part. All right? When you look your best, have alfalfa hay. Obviously, you can add, get a feed that has more calcium or supplement calcium in the diet. But all those things are a consideration in terms of preventing this. Okay. Now we got that out of the way. Now let's go to the real crazy stuff. HYPP. hypervolemic periodic paralysis. It is a genetic disease of quarter horses and quarter horse crosses. So everything with Appaloosas and paint horses and all of that get thrown into the mix. This one is an autosomal dominant type trait. So this is genetic disease, transmitted, autosomal dominant. Most of the other things we talked about so far have been autosomal recessive. This is autosomal dominant. It causes a defect in the skeletal muscle sodium channels, which means it gives you abnormal muscle, skeletal muscle sensitivity. Right? These animals are constantly depolarizing. Okay, when they go through an event or go through an episode. So it makes the membrane very, very sensitive, persistent depolarization caused by a point mutation, like I said, that governs skeletal muscle sodium channels. So in other words, sodium is being driven in to the cell, potassium is being driven out, all right, into the cellular fluid, all right? Characterized by recurrent episodes of muscle tremors, myotonia, weakness, paralysis, and then possible collapse. Right? That's the most common type clinical signs that you see. Now, the biggest thing and the freakiest thing about this, it is